Today we are going to discuss about a study on how yoga can reduce anxiety and insomnia in people who are living with cancer. Advances in oncology have resulted in a growing population of cancer survivors. They often contend with persistent physical and psychological side effects after completion of active treatment. Epidemiologically, up to 95% of survivors report sleep disturbances or insomnia, while over 50% report clinical mood disturbances, anxiety, or fatigue. These symptoms frequently co-occur and sometimes can be managed pharmacologically. However, it can have sometimes a negative impact on life. Now, a recent study on a large-scale randomized clinical trial, which was presented at American Society of Clinical Oncology annual meeting in Chicago 2026, the study enrolled 410 cancer survivors in the United States. The inclusion criteria required no yoga practice in preceding 3 months and non-metastatic disease. The average participant age was 54 years with breast cancer, world's most common malignancy, comprising 75% of cases. Patients were randomly allocated into two groups. The standard care group, where the sample size was around 204, received conventional survivorship care, including maintenance therapy, follow-up visits, and side effects monitoring. The yoga intervention group consisted of around 206. They received standard care plus yoga for cancer survivors program. This 4-week intervention consisted of 18 gentle Hatha Yoga and restorative yoga poses, breathing exercises, and mindfulness. It included two 75-minute instructor-led sessions weekly and at least 30 minutes of home practice every day. What were the findings? Using validated questionnaires to assess the outcomes, this study demonstrated statistically and clinically significant improvements in the yoga group compared to the standard care. The mood disturbances significantly reduced. Anxiety significantly reduced. Fatigue significantly reduced. Insomnia, the intervention indirectly improved insomnia through positive mood changes, and the mood disturbance, anxiety, and fatigue came down. One of the lead authors of the study states that there is currently no single gold standard behavioral treatment for these co-occurring symptoms, and this study fills a critical gap by demonstrating that a structured yoga protocol can simultaneously address all 4 common side effects. And another author also described the study as an important advance. They also emphasize that it offers cancer survivors a non-pharmaceutical, low-risk intervention to manage multiple debilitating symptoms which occur concurrently for some patients, and this could be helpful in managing without a medication. This rigorous clinical trial provides a high-quality evidence that gentle Hatha Yoga and restorative yoga is an effective integrative oncological intervention. For clinicians and healthcare systems finding support, the referrals of cancer patients to a structured, evidence-based yoga program as a part of routine survivorship care to non-pharmacologically manage anxiety, fatigue, mood disturbance, and insomnia. So for a common man, what does this study hold true? Or how does this study help a common man? a common man who has been, suppose, suffering from a cancer and surviving and going under the treatment, and as a possible side effect, if this were experienced, try to take an advice of a yoga therapist who can help you with basic Hatha Yoga exercises, which are very simple and gentle in nature. And with these, you may find a significant difference in the quality of life which you are experiencing due to this illness. So thank you very much for joining me today on this episode on how yoga can reduce anxiety and insomnia for people who are living with cancer. Namaste.